Peripheral arterial disease can cause leg cramping and can lead to much more serious health problems. Dr. Robert Ullman of Boca Raton Regional Hospital joins us this afternoon to answer our questions and the many questions we have. Thank you so much for your time today. First of all, abbreviated, it's PAD. What is it?
PAD stands for peripheral arterial disease. It results from plaque buildup and atherosclerosis in the blood vessels, most often in the legs.
And who's at risk of developing it?
The risk factors are diabetes, high cholesterol, cigarette smoking, even advanced age.
And what can happen as a result? I mentioned leg cramping, but much more serious illnesses. What can happen as a result?
Typically, peripheral arterial disease causes leg pain and muscle pain. Most often it's with exercise and relieved with rest.
Now, atherosclerosis can play a role in diagnosing PAD, correct?
That's true. So the diagnosis of PAD is based on identifying the effects of the atherosclerosis, or the plaque buildup in the blood vessels.
So what are some of the treatment options available?
There's several medications. A common one is aspirin plus dipyridamole. The aspirin acts as an antiplatelet agent that stabilizes the plaque and minimizes the plaque buildup over time. And the dipyridamole actually dilates the blood vessels and helps restore blood flow.
Dr. Ullman, how common is PAD?
It's actually very common. Surprisingly, many patients who have coronary artery disease or risk factors for coronary artery disease also have peripheral arterial disease, and there's a very high correlation between the two.
Now, sometimes stents are needed to treat this. Who is a candidate for that?
That's right. Well, medications, diet, and exercise are really attempted first, but for patients who continue to have symptoms or if they have severe disease, then definitely an option is the balloon angioplasty and stenting procedures to open the blood vessels.
Now, is that risky?
It is risky, but it's a minimally invasive procedure. So all procedures have risks, but the risks are actually quite low for this procedure.
Now, if a patient has PAD, are they at a higher risk for developing heart disease?
They are. The association between PAD and heart disease is actually quite high.
But treatments are fairly, I don't want to say simple, because if you're doing stents, there is risk involved. But it is, as you said, it's a minimally invasive procedure. So if you start with diet and exercise, if it's detected early, it is easily treatable in many cases?
It is. There's actually a very good outcome. The important thing is to see the doctor regularly and evaluate for the disease at the beginning and to catch things before they become a problem later on.
Are there people who should be tested preventively for this? And who are they?
There would be patients that are at risk, so they would have the risk factors of diabetes, high cholesterol, cigarette smoking, high blood pressure.
And we'll close on that note. Thank you, Dr. Ullman, for your time today. Dr. Ullman is sponsored by Boca Raton Regional Hospital, which also underwrites our Ask the Doctor segment. We're back with more in just a moment.